Hello, everyone. We are live with another episode of the Embracing Joy podcast. And I'm very excited to have our special guest here today, Dr. Laura Suttin. Thanks for joining us today.
Yeah, thanks for having me.
So, our topic today is about building better healthcare systems so that they could be filled with joy and purpose. So, let me tell you a little bit about Dr. Sutton. She's a family physician, a certified coach, a consultant, an author, and a speaker. And she founded Purposeful MD to help physicians create lives that they love without guilt. She also published her book, The Purposeful MD, which was published in 2024. In her free time, Laura enjoys running, triathlons, travel, and glamping with her family. Yeah, so thanks for joining us.
Sure, it's good to be here.
Yeah, can you tell us a little bit more about, before we get started, about Purposeful MD?
Yeah, Purposeful MD, I founded in 2021 for coaching mostly in the healthcare space. And I was lucky enough to be able to work with a coach myself when I started my leadership journey about 12 years ago. And coaching has just had such a profound impact on me. And I strongly feel that every physician needs a coach. I feel like if our professional athletes have coaches, our physicians need coaches because
Mhm.
our lives are literally depending on them. And so with Purposeful MD, I really want to bring coaching to as many physicians and healthcare professionals as possible. I also do consulting and speaking, so workshops with healthcare organizations to help to try and really dismantle some of the real barriers to physician well-being and work on some of the structural challenges that need to get accomplished and need to get fixed in order for our healthcare teams to thrive. Because when that happens, then everybody wins. The organizations thrive, the clinicians thrive, the patients thrive.
Mhm. Yeah, well, it's it sounds like a great, not to be pun intended, but it's purposeful work, and it's such a important mission to help physicians who can in turn help patients in their communities. So thank you for the work that you're doing. So we usually start out with a short game. It's called Convergence. So how it works, it's an improv game. I
Okay.
will say the first word that comes, we'll both say the first word that comes to our mind on the count of three. And then once we both said our word, we try to think of a word that connects the two. Try not to get too specific, like people's names or specific areas, and just try to keep it broad. And that way, we're most likely think of the same word. You ready?
Okay.
Okay, so on the count of three, you're just going to say the word that comes to your mind. Okay. One, two, three. Comb. I don't know why that came to mind, but comb came to mind.
Mine is joy.
Oh, joy. That's a
Yeah.
great one.
Yeah.
Okay. So joy and something that combines joy and comb together. Okay. You ready?
Yeah.
It can be anything, like very broad. It can be, yeah. Okay.
So
Uh,
comb like a hair comb?
like a hair comb. You
Yeah.
ready?
Yeah.
Okay. One, two, three. Swimming. I thought swimming.
Mine is beauty.
Oh, beauty is good. I was thinking of the Little Mermaid
Oh,
because she had a comb, but
I
that's
like
too
that.
specific. So yeah, she used a fork as a comb. But
Yeah, the dingle hopper.
yeah, okay. So you said beauty,
Yeah.
and I said swimming. So something that connects those two together. You ready? One, two, three.
Water.
Ocean. Yeah, there we go. So
Yeah.
that counts. So
Yeah.
that's the same. Yeah, the same. Even though it's not the exact same word, it's the same meaning. So ocean and the water. So
Yeah.
yeah, great. So it's a fun little warm-up game before we delve into our questions. So you've been working very closely with physicians to help them build lives and careers that they love. And what would you say are some of the essential elements of the healthcare system that truly supports physicians in practicing with both purpose and joy? Like, what would be the essential elements?
Gosh, there's so many. If I had to think of it like a recipe book, I think that was one of your questions, what would I put in my recipe?
Mhm,
I feel like the environment the physicians train in is, at least when I was training, and I don't want to say how old I am, but it was a while ago. It was not supportive of our emotions and all of the challenges that we experience as physicians, all of the things that we go through, and you just think about physicians are delivering babies and performing CPR and telling
mhm,
people they have terrible diagnoses. These are things that most people don't experience in their life
mhm,
on that end. And yet we don't, at least we didn't. I think it's changing, but we didn't allow time and space and even names for those experiences and those emotions. And now we're seeing the consequences of the denial of those emotions. And so I feel like even just an awareness and a recognizing that, yeah, we went through some tough stuff and we're still going through tough stuff. So,
mhm,
how do we manage through those emotions? How do we talk about it? How do we should be vulnerable with each other? I think that's one important piece. And then just how do we make sure we're staying in community with each other? I think, that during COVID was a challenge because we weren't able to be together physically. And so, of course, we have these novel ways of getting together, like Zoom and all these other
mhm,
platforms. But how do we ask for help when we need it? How do we rely on our community? How do we lean on each other?
mhm,
And again, I'm not as in touch with the medical education space, but I have colleagues who are, and what I hear from them is that the medical education landscape is changing. So that makes me very hopeful because we can't have more generations of physicians who just stuff down their emotions and aren't given the tools and aren't modeled how to manage through it. It's not healthy for anybody.
mhm. It's not healthy. With family medicine, so I'm a family physician as well. So during my residency, we had a psychologist as part of our residency program, like as part of the family medicine program. So, and she would have every now and then we would have like just feeling or thought circles. And that was something that was nice to incorporate into the program because I know not a lot of programs don't have something like that, even though it was not, it wasn't something that occurred all the time. It was something that we were able to, experience and have that time to be vulnerable with each other and with her present.
Hmm.
Um, yeah.
Yeah, yeah. I know those spaces can be really, really helpful.
Hmm. 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 Yeah. So just, yeah, I think you're right. As physicians, there's not a lot of opportunity for vulnerability or time to express emotions. And that would be helpful within if it was incorporated within the healthcare system.
Yes. Yeah,
Um,
absolutely.
yeah. So with that being said, a lot of these healthcare systems unintentionally fuel burnout because there's not that space for physician well-being.
Hmm.
What changes can some leaders implement right now to create an environment where both the patients and providers are able to thrive?
Yeah. I think a few things, and they're not necessarily difficult.
Mhm,
They're simple, but they're not easy. I've heard that before. One is listening to your frontline workers because they're going to tell you what they need. And I fell into this I walked a line between being a leader and a practicing physician for 14 years. So I know I made lots of mistakes on this of assuming what I think they needed based on what I was seeing rather than really listening to the physicians in the front line. And then I think, at least what I've seen is a lot of leaders are afraid to do that because they are afraid that they can't give the physicians or the frontline workers what they're asking for.
mhm,
And I get that. I've been in that situation. At the same time, not asking is detrimental, and asking and then not doing anything on what they're telling you is even more detrimental. So I've seen all of that. So if we as leaders can't give the frontline people what they're asking for, we have to be transparent about why is what's going on around that. So transparency is really helpful. When information is missing, people will make up all kinds of stories, and
Mhm.
so it's important to be as transparent as possible. And I think as leaders too, and again, a lot of leaders are clinicians. A lot of leaders are not clinicians, but there's still kind of some of that same ethos about we sacrifice at all costs and we don't take care of ourselves. I mean, corporate America has had a really bad reputation for this over the past decades of working themselves to death. So, how can our leaders model this behavior? How can our leaders model taking time off and not attending meetings while they're on PTO, or really disconnecting when they're off? And when our leaders are able to model this, and that might require coaching for the leader. Maybe the leader needs to uncover what's going on, why they feel like they can't, why they feel like they have to check their email while they're sitting on the beach with their family. Then our clinicians give permission to do that as well, to really disconnect and take time for themselves. And not even something as extreme as taking a week off, but go to the bathroom. I mean, I coached physicians recently who said that, oh yeah, I didn't go to the bathroom all day, but it's okay. No, that's not okay. And
Mhm.
so how can our leaders both model the behavior and also create environments so our physicians can be successful and take care of their own needs? And so, again, it's stuff that it's not really rocket science, but it's not consistent, I would say.
Mhm. Yeah, the bathroom thing is real. You know?
Yeah.
Yeah, because, sometimes I've had times where you don't wanna drink water because you may need to use the restroom and you may not have time between patients, but I had to learn, like, no, I need to drink water and I need to use the bathroom. I'm
Yes.
human. We are human too, right? So,
Yes.
yeah.
Yes.
Yeah. Okay. But I'm sure that's different for surgeons maybe because they have to be in the OR, in the operating room, not a surgeon. So this is outpatient clinic, but different physicians have different needs and ways they have to
Yeah.
deliver those things.
Yeah, absolutely. Every situation is different. At the same time, surgeons are people too. And so, how can we make the best of these constraints that we're given so that we can still, pardon the pun, but operate effectively and still take care of our workforce? So,
Mhm. So a lot of your work emphasizes like aligning purpose with a structure or way to do that. So for the physician who feels very stuck in a system that doesn't reflect their values, where can they start in creating a change, either within their system or kind of designing something new for themselves?
yeah. Well, so what you said there is really important about something that doesn't reflect their values. One of the most important things, and I think is foundational, is know what your values are. And I talk about this a little bit in the book. I do a lot of work in my speaking and with my clients around it. Is if we don't know what our core values are, we don't know whether or not we're in alignment with them. So we have to identify them. And once we do, everything just is a little smoother. We can set boundaries in a better way. It We don't have to make as many decisions because we've already kind of put that stake in the ground. This is what I stand for. This is what's important to me. And then when those conflicts come up about, well, should I attend this event or attend this event? Should I, all these different decisions we have to make, they just become a little bit easier. So, for instance, my daughter is about to start college. So she just graduated high school. And one of my priorities, being a value of mine, is my family. So one of my priorities was spending time with her during her senior year of high school and making time and space for her school events and those types of things. And so because I prioritized that early and I created that environment for myself, I didn't have to make as many decisions as things came up. I had opportunities to attend conferences and other types of things, but since I had created that priority early on, I didn't have to make those decisions. And so decision fatigue is real. The more we can reduce how many decisions we make in a day, the more it frees up our mind to be creative. So that's something that's really, really powerful, knowing what your values are and finding ways to live in alignment with those values is that, I mean, that will make our lives easier just in and of itself.
Mhm. So someone that doesn't know what their values are, what's like the first place that they should look or start to kind of figure that out?
Yeah. I usually reference there's all kinds of different core values lists. James Clear has one on his website. I think Brene Brown has one. So even taking a look at a core values list and picking out what are 5 or 10 words on there that speak to you. And then I usually have my clients rank them from 1 to 10. I've also heard exercises around what do you want to feel the most? So identifying what is it that you want to feel? Do you want to feel safe? Do you want to feel secure? Do you want to feel joyful? Do you want to feel creative? Do you want to feel inspired? What are the feelings that you gravitate towards most? How do you spend your time? What lights you up as far as spending your time? What types of environments do you like to be? Do you like to be in nature? Do you like to be in cities? Do you like to be in very stimulating places or very quiet places? So those can really asking ourselves those questions can help us to hone in on those.
Yeah, so I mean that sounds very important to know and to take time towards, like
Yeah.
knowing so that you can live with more purpose, like what you
Yeah.
do. Yeah,
Yeah. It's one of my values. So
yeah, yeah. So thank you so much. I think this has been an excellent conversation. We're going to go into our wrap up questions, which are who is a model for joy in your life and why?
so I always feel like small children are just unbridled joy. They just like between like 3 and 4. Once they get to be a little older than that, then they start to have kind of these experiences of what are other people thinking of me. But the 3 and 4 year olds are just, yeah, unbridled. They do whatever they want. They don't care what anybody else thinks. They're not always joyful, but it's just this freedom of spirit that I think it's really it's fun for me to see it, especially since my kids are not that little anymore. When they're that little, it's not it's a different perspective, but yeah,
Mhm.
just very freedom of spirit.
And then if you were cooking a cake of joy, metaphorical, what would be your top three ingredients?
I would have to put music in there. Music is really important to me. Nature is just brings me so much joy, and then my family.
Mhm. Nice. Yeah. Beautiful cake. So this was such a wonderful conversation. If our audience, if they want to reach out to you, what is the best location if they want to learn more about what you do or your services?
Yeah, the best place is my website. So thepurposefulmd.com. It's undergoing a refresh. So depending on this when this comes out, it might be new and improved. And I'm on Facebook as myself and LinkedIn as myself as well, Laura Sutton.
Okay. Well, thank you so much, Dr. Sutton. It has been a pleasure having you. Everyone listening, or if you're watching the replay, please share this episode with a friend. Make sure you comment and subscribe so that you'll be notified of each upcoming episode. Okay. Thank you.
Thank you.